Bismillahirrahmanirrahim. We are talking about the Huntington disease. We will discuss the detail of Huntington disease in other video. Now we will discuss and summarize the Huntington disease. Huntington disease. The Huntington disease is the autosomal dominant disorder. Huntington disease is the autosomal dominant disorder. In this type of disease, there is mutation in the CAG repeat sequence. Mutation in the CAG repeat sequence. Mutation in this CAG repeat sequence occur. CAG repeat sequence occur on the short arm of chromosome number 4. On the short arm of chromosome number 4. In the Huntington disease is the autosomal dominant disorder in which the CAG repeat sequence mutation occur in the short arm of chromosome number 4. Normally, the CAG repeat sequence function is the formation of Huntington. Huntington is a type of protein. Normally, there is the formation of Huntington protein. This Huntington protein clears the ubiquitin and Huntington fragments. Fragments from CNS. This Huntington protein present in all over the brain, and the function is it clears the ubiquitin and Huntington fragments from the CNS. The ubiquitin and Huntington broken fragments are neurotoxic. They can cause damage to the CNS. Normally, this Huntington protein function and clears the neurotoxic fragments from the CNS. This CAG, when CAG mutation occur, in the mutation in the CAG repeat sequence occur, which involve the Huntington abnormalities. When this repeat sequence mutations and this mutation number increase in greater than 40, then Huntington disease occur. Huntington disease occur when the number of CAG increases greater than 40. When the number increase much more, so the disease may be severe. The severity of Huntington disease depend on the number of the CAG repeats. When there is more number of CAG repeats, the Huntington disease is more severe. When the CAG repeat sequence number is range from 36 to 39, they cause the disease in some patient. Cause Huntington disease in some patient, but not all. But when the number of CAG increase greater than 40, the Huntington disease develops. If the number increase more than 40, the severity of the diseases occur. Severity of the diseases depend on the number of CAG repeat sequence. The largest the number of CAG, the more the severe of the disease. When there is CAG greater than 40, CAG number increase greater than 40, there is mutation on the chromosome, short arm of chromosome number 4. This normally CAG involved for the Huntington protein formation. Huntington protein clears the neurotoxics ubiquitin and other Huntington fragments from the CNS. They clear the neurotoxic material. When then Huntington disease occur, there is no Huntington protein. There is no normal structure of Huntington protein, and the striatum and cerebral cortex are involved in image. The striatum, cerebral cortex are involved, and there is atrophy of head of caudate nucleus. There is atrophy of the head of the caudate nucleus, and there is also atrophy of the head of the. There is atrophy also of the lateral ventricle. There is also atrophy of the lateral ventricle. The atrophy of the lateral ventricle can be seen in this case with the help of MRI. The potamen is severely affected. The potamen in this type of Huntington disease is severely affected. Potamen severely affected. The symptoms occur due to this abnormal structure of the Huntington protein. There is motor symptoms. A motor symptom can be rapid, non-pattern, semi-purpose movement. There is rapid non-pattern semi-purpose movement. Sometimes this is called Huntington chorea. In this Huntington chorea, in the advanced stage, this Huntington chorea may be transfer and change into dystonia. They change into dystonia. In this dystonia may be change into bradykinesia in advanced stage. Bradykinesia is Parkinson's symptom. This is the atypical Parkinsonism may be developed. Now we will discuss the oculomotor changes. Oculomotor, that is visual disturbance, occur. In cognitive dysfunction also occur. Cognitive dysfunction can also occur. Dementia may produce dementia. Weight loss occur. The interesting thing is the diabetes mellitus may be developed in the Huntington disease because the Huntington disease is involve the multi parts of body. Multi parts of body are involved in the Huntington disease. The depression may occur. Depression, psychosis, social thinking will develop. The family histories are positive in cases of the Huntington disease. Now we will discuss the treatment of Huntington disease. Treatment. We give the symptomatic treatment. Symptomatic treatment for Huntington disease. For example, if the patient has depression, for the depression we give antidepressant. We use antidepressant for the depression in the Huntington disease. Example is clonazepam. The dosage is 50 to 600 mg per day. We give the social counseling of the patient. Social counseling because they may be develop and they may convert and they think suicide. We give the tetrabenzene. Tetrabenzene are dopamine depleting agent. They are dopamine depleting agent. But this tetrabenzene can cause Parkinson disease. We give tetrabenzene with careful monitoring. So there is symptomatic treatment of the Huntington disease.